And of course, we also have with us the Permanent Secretary, Lagos State Minister of Health, Dr. Olusegun Obuyi. And of course, our very, very Honorable Commissioner, a man that believes for all Lagosian, a man that knows what to do at the right time, keeping all Lagosians safe. Distinguished ladies and gentlemen, the Honorable Commissioner for Health, Lagos State, Professor Akin Abayomi. Without much ado, the Honorable Commissioner, I believe the gentlemen of the press have been waiting for this briefing for long, and they are happy that we are having it this time around. Without much ado, the Honorable Commissioner, I invite you to the mic, sir. Honorable Commissioner for Health, Professor Akin Abayomi. Let's put our hands together for him.
Good afternoon, ladies and gentlemen, members of the press. Sorry, we've broken with our tradition of meeting with you regularly because I was out of the country, I was out of the state. I was in Abuja for a few days, and on my return there were quite a few things that had to be addressed, which didn't give me the time to share my usual daily press parley with you. So I apologize for that. We'll try and get back to that routine from next week, where as things are heating up, but I will still try my best to make a little bit of time for you as often as possible so that you can inform yourselves and the public on how things are moving on a day-to-day basis. The situation is very dynamic. Lots of scenarios are presenting themselves, and I just want to give you some of the updates that we've got so far. So as of yesterday, we released the cases of 11 new confirmed cases in Lagos State. So that seemed to be a little bit out of proportion because we have been reporting somewhere between 3 and 5 and 6 on a daily basis. So 11 seemed to be a large number. But that 11 included an unusual situation where we have a marine vessel that is on our coastal waters that is involved with the oil and gas industry. And on that vessel, there was a sick patient who we are able to evacuate from the ship. The crew comprises of 51 crew members. We evacuated the sick individual, we tested him, and he turned out to be positive and has been admitted to our Yaba facility. Being that he was positive, it was necessary for us to return to the ship and identify the closest contacts to this individual and to test the entire ship. So we ran tests on the remaining 50, and out of the 50 we were able to identify 6 positives. There were 6 positives remain on the vessel in an isolated environment, and this morning we will be trying to define how we're going to manage that scenario. So there are multiple options available to us, and I will be in conversation with Mr. Governor and other members of Cabinet to define how we will manage that situation. So apart from the 6 that were on board, so that gives us a balance of 5 that were diagnosed in the state. So if we subtract 6 from the 11, we have 5. So there were 5 new patients in Lagos yesterday. Another scenario that is occurring at the moment is, as we expected when we closed our air borders, we would experience an attempt of Nigerians to return home through our land borders. So there would be a case where Nigerians would fly to neighboring countries and try and drive into Nigeria through our land borders. As we speak, we have a situation at the Seme border where we have 16 students who are trying to return back to Nigeria. The details of where they went and what they were doing outside of Nigeria is not clear to us at the moment. But we have sent a dispatch to the Seme border to go and retrieve the 16 Nigerians, I believe they're students, and bring them to one of our facilities, probably at Yaba, once I get more information, where they'll be screened and evaluated as to what their risk is, and then we will define whether they need to be tested, and if they're tested, then we will determine, based on the test, what we're going to do henceforth. But that's just to give you an impression of what may be happening at the border. We don't have much detail, but it's under control. We've been in discussion with federal. Mr. Governor has ordered the dispatch of a team to the border to meet with our immigration colleagues, and the contingent will be handed directly over to us as Lagos State Government, and we will bring them to a facility where we will screen them and determine what their risk is and proceed with testing if required. So otherwise, at the Yaba isolation facility, we haven't got any patients that have developed any complications. Most are going through their natural course of the illness. They're going through mild symptoms of respiratory tract infection, fevers, and body pains, and they're all responding very nicely to treatment. And we expect that in the next day or so, we are getting ready to discharge those that are becoming not contagious by our molecular testing. So the outbreak is changing in its dynamic. We expected that since we're not having any more imported cases. Most of the cases we're seeing now are due to local transmission, and predominantly local transmission from contacts who are high risk and who have returned from high-risk countries. And we're beginning to see one or two who we are not sure where they acquired the infection, which gives us the impression that the virus is slowly beginning to circulate in the community. This is why we have deployed our second strategy, which is that of social and physical distancing. What do we mean by that? We've sent out multiple educative videos and animations to show you that the idea is that we interrupt the opportunity for the virus to spread from one person to another. And there are multiple dimensions of that. Essentially, you create a distance between anybody and you ensure that surfaces are cleaned and that you exhibit personal hygiene and that people with respiratory symptoms are isolated, and if you have the features of coronavirus or you've had a risk, that you inform us and we come and evaluate the situation, we test you. If you're positive, we will admit you into our isolation facility, and that is all in the process of stopping the virus from gaining the opportunity to move from an infected person to a non-infected person. This is a very effective strategy if applied properly, it will dramatically change the profile of the outbreak. Eventually, the virus will run out of opportunity and the outbreak will naturally die out. So our two strategies are containment, and our second strategy is social distancing. I know there will be a number of questions around testing, so I will explain again. There are a number of important things that the public need to know about testing. So the testing for corona is a very elaborate test. It is what we describe as a molecular test, and the test is performed only in designated laboratories because of the complexity of the test. The test is either positive or negative. In other words, the virus is either present or it's not present. We do the test from the respiratory secretions, so from the nose or the mouth, or we take a sample of saliva or sputum. We do not do a blood test for COVID-19. The test is specific and is extremely accurate in the right hands. And there are 3 laboratories that have been designated to carry out those tests in Lagos. And there are a couple more in the rest of Nigeria. We're ramping up our capacity to increase our testing numbers. As we increase the capacity at these 3 designated laboratories, and in due time, we are looking at projecting to increase the number of facilities that can carry out this very sophisticated test. In the wrong hands, it can be problematic. So it's important that we keep the quality assurance around the testing very tight and very accurate, so that when we say you're positive, we know you're positive, and when we say you're negative, we know you're negative. In addition, our tests have the ability to define how much virus is in a person that is infected. This is very helpful to us because it helps us to define how a patient is responding to our treatment, and also helps us to determine when a patient has become completely not contagious. When we get a negative test, it means they are no longer secreting the virus, and the immune system has effectively eliminated the infection. The first negative test is when we tell the patient that we believe that you've cleared the infection. We have to repeat it one more time just to make sure that they are truly negative. And it is only after this point that we discharge the patient back into community, because at that point we believe that they do not pose a threat through contagiousness to the rest of society. And then we can discharge them. You've heard a lot about rapid tests. There is no recommendation right now on the use of rapid tests for simple reasons. The accuracy of the rapid tests have not been determined. And those accuracies have to be determined in this environment through a process that we describe as validation. These rapid tests have a very variable degree of accuracy. And we're seeing reports that some of these rapid tests have as low accuracy as 30%, which means that if we tested 10 people, 7 out of those 10 people we would be giving wrong results to. That scenario is totally unacceptable for us in the public health sector. And so until we can determine which of the rapid tests are exhibiting above 97 at least % accuracy, we would not be recommending any rapid tests in the community to be delivered by anybody, because the consequences of giving wrong results have significant public health implications. We're therefore discouraging the public from going to any public or public or private facility where rapid tests are offered. We have not given the go-ahead for the use of these rapid tests. Neither has the WHO or the Nigerian Center for Disease Control, and neither has the Federal Ministry of Health. An elaborate process of validation needs to be embarked upon before we can make recommendations on the use of rapid tests in our public health situation. Furthermore, if there are any medical facilities that are offering testing for COVID, this is not correct. There are only 3 testing sites in Lagos, and they are the Yaba Infectious Disease Hospital, the Lagos University Teaching Hospital, and the Nigerian Institute of Medical Research, also in Yaba. No other facility has been validated to offer COVID-19 testing. So if you're being told that anybody outside of those 3 reference laboratories is providing COVID-19 testing, it is inaccurate information. So on that note, just to say that at this point in time, we believe that our strategies, as outlined by the incident commander, Mr. Babajide Sanwo-Olu, the governor of Lagos State, our strategies are showing some fruitful outcomes. Social distancing is very important. We implore all citizens of Lagos to follow the clear instructions of the incident commander, who is making regular public announcements for your information through the media. I will pause now for any questions, and then I would like to show you some brief data analytics that we've done, just to give you an idea of how Lagos is performing and what we expect to see in the coming days. So I will pause at this point.
Honorable Commissioner, thank you very much. Gentlemen of the press, I believe we have 1 or 2 questions to ask. Please, can you please indicate? Okay. Just introduce
I'll just use my voice, don't worry.
Just introduce
myself
yourself and your media.
Sure, thank you. Commissioner, my name is Adikami Akinsanya from Arise News. My question is twofold. On the one hand, if we were to focus about the cases on the vessel, I know you said that predominantly they remain on the vessel. If you could share some information about what kind of plans are in place for how they'll be brought out of the vessel for testing and how they're supposed to navigate henceforth. And also, we were at Onikan Stadium yesterday, and we've seen that there's a makeshift isolation center being built there. It did look quite substantial, looked like it could carry a lot of people. That is part of the preparedness, but is that because there's a direct concern that that space is adequate, that we can expect to see a huge jump in numbers of cases in the near future?
Any other question, please? Okay. Amina?
Good afternoon, sir. I'm Amina Tadebuchi, correspondent, Lagos Daily. Yesterday, it went viral on social media that 6 patients have been discharged that are free from the virus, and then they will be discharged. So now during that. And secondly, people want an education on who, when to use the face mask, because some of us here are using it. When should it be used? Who should use it?
Thank you. Okay.
My name is Mr. Osman from NTA. In addition to what you talked about, 6 patients that are a lot of people have been saying that shows that has symptoms of the virus itself, and found it very difficult to access medical services and all that. So please, I know you've done this a couple of times, but I want you to just make it clear one more time. Like, if a person discovers that he has the symptoms of the virus, is it a must that he calls, or should the person go to one of these centers? Thank you.
And the last one for now. Oh, yeah.
Honorable Commissioner, sir, my name is Dario, originating from Untitled Chapter. I want to ask, the need to establish more isolation center, why the need to establish more isolation center? Then on testing, on the outbreak, how many people have been tested so far since the outbreak?
Thank you very much. Honorable Commissioner, sir.
Okay, on the first question around the vessel, this is brand new information, so we're just trying to work out the pros and cons of how to manage this situation. We could make the vessel a floating medical facility and just supply it with necessary provisions and expertise and allow the infection to ride itself out on the vessel. Or we could decide that, the logistics of that would not be suitable and we would need to evacuate the entire ship and triage them and move them into different kinds of isolation. So that there's no urgency to the matter. Nobody is desperately sick on the ship. So we have time to really think about the logistics and find the best solution for that floating scenario that I've just presented. Yes, in terms of the need, the tent at Onikon, we felt that Onikon Stadium is a very suitable place to erect a temporary structure because the stadium in itself provides adequate physical facilities. It's been recently renovated, everything is brand new. It has lots of ablution facilities, doctors and nurses the architecture can accommodate doctors and nurses, overnight stay, and it has conferencing facilities, it has catering, it has ablution facilities. So it's a perfect place to put a temporary structure on the playing field. So why are we doing this? Well, we feel it's better to be prepared than to be sorry. So we are making an exaggerated attempt to increase our capacity to isolate positive cases. If we don't need it, all well and good. But if we need it, then it's better that we have made the provision for it. If we watch the global trend, it's very easy for the situation to get out of hand. It's very easy for the situation to get out of hand. So if any of our strategies or if the community are not responsive to our recommendations, then things can get worse before they get better. When the virus is spreading through a community, it can spread in an exponential manner, and such, if the social distancing strategy is not adopted by the community, well, as government, we have to make the provisions to accommodate the eventuality. So the situation at the isolation facility in Yaba is changing every day. As we test, we're finding people who have cleared the virus, and as I explained earlier on, you have to have demonstrated you've cleared the virus twice. Those patients that clear the virus on request from us, they donate some blood to us. We use that blood in our facility to generate what we call the antibodies. These are the proteins that fight the infection. And we purify those antibodies and we package them in a way that we can use in the future for other patients that may be presenting. It is a recognized treatment strategy to use the blood of people that have recovered to manage patients that are coming in, especially those that may be coming in with extreme complications who we need to try and rescue from organ failure. The details of who will be discharged, I do not have the exact details here because I haven't been to the center yet, but later in the afternoon the team on ground will present to me and to Mr. Governor the patients that have recovered and are ready for discharge. And we're expecting that over the next couple of days we're going to be discharging many of the early patients that we've admitted as they've completed their treatment protocol and they have now recovered and are ready to go home. So as we discharge patients, we will now be admitting new patients. So it's like patients in and patients out. Regarding face masks, we've given this advisory over and over. You do not need to wear a face mask unless you are a medical personnel. Face masks are becoming scarce on the market. If you are walking around with face masks, you are depriving the medical fraternity of their protective gear, and that is forcing the price of face masks up in the market. However, if you are unwell, there is an indication for you, especially if you're unwell with a respiratory tract infection and you're in your home. Before we come and test you, it is advisable that you wear some kind of nasal mouth guard so that you don't infect the people in your environment. But other than that, if you're not unwell with a respiratory tract infection, we do not recommend that you walk around town wearing a face mask. It's not going to protect you. But if you're unwell, then wearing a face mask will protect the people around you from whatever the pathogen is. Now, if you have an upper respiratory tract infection, you're coughing and sneezing, 99% of times it will not be corona. It will be the common cold or any other flu infection or respiratory tract infection. In all our testing, we only find a very small amount of people with the symptoms are actually due to infection with corona. Our access to medical services remains the same. It's the 08000 corona number, 08 000 corona. If you dial that number on your smartphone, you will reach somebody on the end of the line who will direct your inquiry to the appropriate expert. And if you seem to meet the criteria for an intervention, then we will dispatch a team to your location to either test you or to collect you because of the symptoms that you're displaying to one of our isolation facilities. So the numbers are working. We're expanding our toll-free lines. Lots of people are still calling in with pranks and just testing the line for fun. We're asking you to desist from that, because every time you are holding a line for a non-essential reason, you are depriving somebody who is trying to make a serious inquiry from accessing our experts behind the scenes. Why do we need more isolation facilities? Well, I think I've addressed that. We are definitely making sure that we are fully prepared for an even larger surge of patients. And so the incident commander has given certain instructions that we create these tents in strategic locations and that we expand our already existing facilities to make sure that we can accommodate a surge or an increasing number of positively identified corona patients. So I think that addresses most of your questions in that first round.
Yeah. Thank you very much, sir. Honourable Commissioner, sir, with your kind permission, I will want the gentlemen of the press, if you have any question, you just come to this side, because we are on network. We are on live broadcast. So if you have any question, so please, you can just sit down so that we can have this on view. I hold you, please. You can sit down. Yeah. So if you have any question, just come to this side.
Good afternoon, sir. My name is Omolara Omosoya. Despite the advisory on soap and water being the best, there is this fixation among Nigerians of using sanitizer, and with the emergence of coronavirus, we've seen so many homemade sanitizers. And please, can you tell us what constitutes the right alcohol content that is supposed to be in a sanitizer, and can it be made at home? Secondly, sometimes a while back, we were made to understand that the ministry is going to be developing its own sanitizer. I would like to know how far about this. Then, so like you rightly pointed out before, the rainy season is fast approaching, and we are going to be seeing so many of the common diseases associated with the seasons. Please, can you again assure Nigerians so that they will not be panicking when they start sneezing, when they start having cold and catarrh and all the other diseases associated with the season?
Thank you very much. Any other question?
Thank you so much, Honorable Commissioner. You're doing a great job. My name is Jibe Ologe, and we run Health Monitor on 31 TV stations nationwide. I also have a dedicated health channel. My worry, sir, is for those people who are not going to be able to watch this broadcast on television. And then they will not, because even LTV is doing a great job, but there are some people who will not be able to watch LTV. Yesterday we were at my 12 trying to sensitize people, and it's like we're talking to ourselves. This group of Nigerians are those people who are at the really lower cadre. I don't know what strategy we have to educate them, to show to them the seriousness of what we're talking about. But these people will not come for testing. So we don't know how many of them are infected. So if you go to my 12, they don't care what you're saying about social distancing. They are all on top of each other. I wept because I knew that if this continues, I don't know what we're going to do, sir. Then secondly, when you walked in, I appreciated what you were doing. So some people were laughing as if it was a joke. When we walked in here, some were just talking, tapping them. Even the members of the press, they're not taking the matter seriously. So I don't know what you're going to do, sir. I know you're doing a great job. I watch you a lot on all the network, trying to sensitize us so that we can sensitize the other people, members of the press, are supposed to responsibility to sensitize the other people. We need to take this matter very seriously. UK did not take it seriously. Boris Johnson today is testing positive. They were still going out. They are not still staying at home when they don't need to go out. I don't know whether I'm going to, but my daughter was telling from the UK that if they find you outside, you pay £30. So because of that, you have to sit at home. But Nigerians, they're still everywhere without a purpose. So I don't know what you're going to do, sir. You're doing a great job. But we members of the press, we need to take this matter very seriously. Thank you, sir.
Okay, yeah. Don't worry, you don't need to go straight.
Honorable Commissioner, sir, on Tuesday when the governor addressed, said the facility at General Hospital is converted to COVID-19 patients. What happened to the patients that are here? Are they going to be evacuated? Where are they going to take them to? Then the Abuja General Hospital, are they going to, the patients that are there before, are they going to be evacuated to, or they will be treated alongside COVID-19 patients? Thank you.
Okay, let's have the last one.
Okay. Commissioner, I just wanted a bit more.
Can you please come to this side?
Sorry. Commissioner, I just wanted a bit more clarity. On testing. I know you've advised against rapid testing because they aren't accurate, but how long is the proper test supposed to take in terms of alphabet?
Or should I start?
Take the first one.
I think I've addressed it. I want to thank initially all members of the press for being here to help government in reaching the people. So a lot of the observations are quite valid. But the more information we give our people, the more we'll be able to improve better health behavior. The virus, we must know, is a totally new one to us. But what we do know about it is that it has a fatty coat, which can be easily dissolved with soap and water. At the same time too, alcohol will also dissolve the fatty coat. So both soap and water and hand sanitizers are quite useful. But we also know you can't carry soap and water all along when you are mobile. So hand sanitizers come in. But in our environment or in our various communities, we encourage you to wash thoroughly for about 20 seconds with soap and you rinse with water. That will be able to dissolve that particles, okay, and kill the virus. Hand sanitizers too, because of the alcohol content, and the recommended by WHO is between 65 to 80% alcohol content. We have improved significantly, especially amongst our general hospitals, in the local production of hand sanitizers, and that is also in circulation. If you use your hand sanitizers maybe for about 5, 6, 7 times, you may also want to say wash with soap and water. I don't know whether that answers that question. And then when you're washing too, you have to wash all your clefts under your nails, even at the dorsum of your feet and your wrist. These are places whereby the virus may be as a form of droplet. Then you rinse thoroughly. Thank you.
Okay, there was a question about what we're doing about the common man on the street. Beyond press conferences, because that's not all that's happening. There's engagements with every strata of society and every group. The Ministry of Information is also out there. They have vans that are going out on the road and talking to people. The Emergency Operations Center is divided into pillars. One of the pillars is about raising awareness in the community. They've done what they call the market storms. They've gone to churches, they've gone to mosques, they've gone on the roads, they've printed a lot of leaflets and posters, and they're engaging people every day. The Ministry of Home Affairs also brought together all the leaders of churches and mosques. They've educated them and encouraged them to also talk to all their people. The media pillar has also gone to schools, at least while they were still open, hoping that the kids, when they know, can also educate their parents and their neighbors at home. And even the governor himself got the local government leaders together and the CDAs, the CDCs in all the local communities. And I think by the time you've reached all those people, I think you've practically reached everyone. So there's a lot of work going on to reach everybody wherever they are. There you go, Chief.
Okay, as I said, most upper respiratory tract infections are not COVID-19. So as the rain starts, as you rightly pointed out, we're going to expect, we can all tell that the weather is cooling down. So coughs and cold will be the order of the day. So you don't need to panic. COVID comes with some characteristic symptoms of high fever, body pains, difficulty breathing, and shortness of breath when the situation is severe. But most COVID-19 patients will behave very much like a simple cold, or in fact, you may not even have any symptoms at all. So it's really the more critical patients that we're interested in rescuing, and if you have any of the symptoms that you feel represent COVID, then you just call our number and we will give you the necessary advice. So regarding testing, so because it's a very elaborate test, it's very specific, its turnaround time is about 4 to 6 hours. So from the point in which we commence the test to the point in which we can read a signal which indicates positivity or negativity, that usually takes between 4 and 6 hours, because there are elaborate quality assurance steps that we have to put in place to make sure that our genetic signal is indeed the signal of the virus. So those are the measures that are done at these very elaborate reference laboratories. We're not advising anybody to go to the laboratories. The laboratories do not have the capacity to receive walk-in patients. We will collect the samples as we deem fit, and the samples will be dispatched to one of those 3 laboratories for testing. So social distancing, as I explained earlier on, is a very powerful strategy. Mr. Governor has emphasized this over and over and over. We have done so from the ministry, and I think it's all over the press, both state, national, and globally. It is important that we follow these principles, which is why we are addressing you today in this larger gathering, so that there's a bit more space between everybody and that you can exercise some degree of social distancing. If we discover that social distancing is not being heeded to, then the cabinet and Mr. Governor may have to make some pronouncements that encourage people to practice the advice that we are promoting in the community. At the Infectious Disease Hospital, we've designated the whole hospital for COVID-19. Yes, we do have patients there that were mainly HIV and TB, including some drug-resistant TB. But we have 27 general hospitals in Lagos, so we're easily able to move some patients around. We can discharge some patients with close home monitoring. So it wasn't difficult for us under these circumstances to evacuate some more wards within the infectious disease hospital so that they can be quickly refurbished and converted into coronavirus wards. So that's what we're doing there. One of the other expansion facilities is at Bagada. We have a whole hospital there that has not been utilized for a number of years because of some infrastructural issues that we've been trying to correct over the last year. We've accelerated those processes, and we're trying to bring that hospital, which is brand new. It's not part of the existing Bagada General Hospital. It's a new hospital. We're trying to correct those infrastructural and electrical issues, and that process is ongoing now, and that will give us an additional 150 beds once it is commissioned in a week or so. And as you've rightly observed, there is a large tent going up at the Onikon Stadium, which gives us the capacity for another several hundreds of patients should we need that. We're also trying to increase our tent capacity at Yaba, so that if we have a sudden surge of patients, we are in a position to accommodate them without stressing the system. We're trying to remain in response mode 1, which is that we are able to receive and manage all patients that are diagnosed positive with corona, rather than manage them in community. If we start to see numbers of patients that exceed our capacity, then we may change our tactic to managing patients in community. But as we monitor the outbreak, we are monitoring and increasing our capacity to manage patients in our facilities and under expert management and overview. So I think that covers most of the questions.
Yeah, Fellow Commissioner, let's have some more questions before we round up your presentation.
So the last we had, we are tracing 1,800 people that the contact list. But now that the cases are increasing, what numbers are we tracing? Thank you.
Okay, my name is Abuja. I coach for civil business protocol. And mine is an observation. And we were at Ileko Market 2 days ago, and one of our respondents happens to have some bugs on her head. She said she used sanitizer with high alcohol content, and then she was burnt when she got to negative 5. So what do you do in this kind of case?
Commissioner, with your kind permission, we'll just take the last one.
Commissioner, my name is Theophilus from TBC. We hear that 6 people have been discharged from the infectious disease center and tested negative. Can you explain to us how they went through the treatment and all of that stuff? We understand it.
Thank you very much.
What was the first question? What was the first question?
The last question. The first question.
LTV.
LTV.
Oh, number of contacts. Okay, so since we discontinued air entry into Nigeria and imported cases, the amount of contacts that an individual has when they present has decreased dramatically. The reason why the numbers were large with the importations is because everyone on the flight is a potential contact. So and each flight has an average of about 250 people. So if a patient came in on a flight, and automatically we add the whole manifest of the flight, plus the people that they've been in contact with since they landed in country. Now most people would have made a contact with about 20 or 30 people. But when you add 30 people to 250, that's about 300. So the imported cases were posing a challenge to us at the beginning. Now the imported cases have since deceased. We're not seeing that scenario anymore. So all we're seeing is local transmission, and around each of the local transmissions we have about 30 or 40 contacts. The sum total of the number of people that we're tracing has just gone over about 3,000, which means that we are expanding our outreach to all these individuals and telling them to self-isolate, and we will be in touch with them should they require our assistance when they develop, or if and when they develop symptoms. When you're using the hand sanitizer, I notice some people can be very generous with the amount of hand sanitizer they put on their hands. And sometimes if it's not in the gel form and it's in the liquid form, and if you're close to a naked fire, obviously the 70% alcohol that's on your hands may ignite. So please, if you're using the liquid form of hand sanitizer, make sure you rub it well into your hands. Do not use excessive amounts. And also, do not replace hand sanitizer with fresh water and soap. If you have access to fresh water and soap, hand sanitizer is not the solution. Please revert to proper hand washing using the technique that we've demonstrated over and over again, and using soap and water. The process of admission is as follows. You can be admitted if your case is diagnosed as positive in community. So if you develop the symptoms, we come to you, we take a sample. If you're positive, we inform you, and we indicate to you that we will be coming to collect you and admit you into our isolation facilities. You will be fetched by an ambulance, and you will be brought in by experts who will admit you into the isolation ward 2, where you'll be managed and monitored with our tests. As I say, our tests are able to determine how your immune system is coping with the virus infection. So over time, invariably, most people have their immune system overwhelming the infection, and the virus load starts to subside. When we talk about virus load, it simply means the amount of viruses that are able to replicate in your body. As your immune system attacks the virus finds it difficult to replicate and multiply, and eventually your immune system will eliminate the virus. Our tests can determine how that process is coming along. When you eliminate the virus, we get a negative result. As I said earlier on, we don't discharge you after that first negative. We wait 24 hours and we repeat it, because sometimes you get a little spike just after you've cleared the virus. That's only natural. So we just want to make sure that you do not develop a spike of a small amount of virus at the time we are preparing to discharge you. If your second result is negative, that would have been 2 results consecutively, then we have a very high level of confidence that you have totally cleared the virus and that you are no longer contagious, and therefore you do not pose a threat to community or to your families or at your place of work. So that's how the testing profile goes. The second category of patients that may arrive at the facility is somebody who is unwell, but we don't know their status. In other words, we do not know if they are positive for COVID-19 or not. But they fit the clinical case definition. In other words, they are exhibiting the symptoms that are characteristic of COVID-19. When a person is unwell in this nature, we rather bring them to our facility and we put them in isolation 1. Isolation 1 is dedicated to people who we do not know what their status is. You will spend a period of about 24 to 36 hours in isolation 1. We examine you, we retrieve a sample from you, and we test. If your test is positive, then you move into isolation 2, which is where we keep confirmed cases of COVID-19. If your test is negative, then your illness is caused by something other than COVID-19, and we discharge you back to community or to your medical practitioner. So that's the second type of patient that we would receive at the isolation facilities of the Lagos State government.
Honorable Commissioner, sir, thank you very much. I believe we should now have your presentation, sir.
So we need to move out of the way.